Hello, everybody. This is Denise Solzback. Welcome to this month's System of Care Expansion Leadership Learning Community. System of Care Expansion Leadership Community is a community that we host, Beth Jewell and I, and she's here and she's going to jump in anytime I miss anything, especially as I'm navigating on Gary's computer instead of mine. Our System of Care Leadership Learning Community meets each month. It's designed to support System of Care leaders, principal investigators, project directors, and other leaders in your community. We address topics important to you. We try to hit all of the requirements of your cooperative agreements, and we really like to be interactive. So we really encourage you to use your chat box throughout the discussion today. We are joined by 4 different communities. We are going to be joined by South Carolina, Allegheny County, Pennsylvania, Chautauqua County, New York, and Cherokee Nation. We are going to, apologies, I'm still getting used to this other computer. We're going to today talk about the understanding of the cooperative agreement, what they require you with regard to governance. We're going to have the opportunity for you to talk with one another with these 4 communities as well as each other through the chat box. We are going to have the opportunity to answer questions at the very end, so feel free to put in questions in the public chat throughout the webinar, and we will facilitate the discussion with our presenters at the end of the webinar. We really want to work with you to identify challenges and discuss solutions to governance structures to include post-award sustainability. Next month's learning community, we are not going to meet formally for the month of July. We are looking for ways, our topics for August, and are very interested in what you have to say about topics of interest that you would like us to cover, not only in August, for the months to come as well. So again, feel free to put in the chat box those ideas as well, and I see Beth Jewell is typing right now to talk to you as well. And maybe she's telling me I'm leaving something out. Oh, she's communicating, saying hi to probably JJ. Okay, let's jump into this. Gary's still trying to fix my computer.
Let me move.
Okay, he's going to try my next slide. So the FLA requirements do require you all to have a decision-making body at the policy level, and it's something that you can develop or you can enhance an existing structure. They're also looking for you to create a reporting and monitoring process so that you're looking to see across your system of care that resources are invested both at the state, tribal, or territory system level as well as the local community level. They're also looking to make sure that you have an infrastructure to increase focus on expanding, sustaining, and implementing your system of care, and that you have a central piece or locus of accountability and responsibility. Okay, Gary, you want to try to advance? There we go, I'm fixed. The governance structure can be created by legislation, a community will. It does not have to be formally established. Sometimes organically grown governance structures tend to last over time and can be sustained beyond your grant award, even without legislation or an executive order or something to that effect. Governance authorities should provide legitimacy, authority, and accountability. Again, that language is coming right from your funding opportunity agreement. And they also advise that the governance, and you will see examples of these, governance for systems of care can exist at state, tribal, local, or even neighborhood levels, and at some places in all 3 levels. And again, you'll see some examples. Governance structures do have to include family members, youth, and young adults, and we're going to talk about that. Some great examples of involvement of family and youth leaders, as well as some challenges in bringing family and youth on board and giving them the voice. And finally, we really need to see that the governance structures represent the cultural, linguistic, and ethnic diversity of your community. And with that, with each of these presentations, we are going to look at history and authority, structure, membership and size, family and youth leadership, cultural and linguistic competency and diversity considerations, roles and responsibilities, and administrative support. And you'll hear examples from each of these 4 communities. And with that, I am turning it over to Gwen. She is the project director in the statewide system of care cooperative agreement in South Carolina. And I have to say, Gwen, I'm sorry, I'm going to call you out in front of everybody. Gwen is actually on vacation in London and still dialing in to present to all of you today. So above and beyond any call at system of care duty, Gwen, I'm turning it over to you.
I don't know whether to say thank you or what in the world are you thinking, but I'm so glad to be here with you all, and even more honored to be here, too, with Gina Kaysen, who's the Executive Director of the Federation of Families of South Carolina. I know you all who do this work, you know that your collaborations are really what makes the work happen, and I cannot think of a better partner than Gina, and learning from her about what young people and families need. So it's a pleasure to be here, and glad to be here. I'm off to try the technology here. Oh my goodness, it works. It's exciting. All right, so just to give you a little background, South Carolina, we call our system of care the Palmetto Coordinated System of Care, and I'll tell you more about that at the tail end of how we got that name. We started with a memorandum of agreement. It was signed back in March of 2014. It is comprised of 7 child-serving state agencies. They started meeting about a year before that. 3 family members joined, and then we had a youth join about 2 years later, and we'll share some challenges with that. I think our youth membership has really added a tremendous amount to our leadership team, but has also been one of the highest and steepest learning curves, too. So just wanted to share that with you. If you all would like to see our memorandum of agreement, there's a link to it. There's also going to be a slide with links, helpful links at the end. Please feel free to professionally plagiarize. We love that, and really would be happy to help share it with you and do anything we can to help you as well. So we have a statewide system of care expansion grant right now. We're in year 3 of our 4-year grant, getting ready to head in that 4th year. And I would say that we're an emerging system. We have a lot to learn, but we're getting there. So those of you all who are familiar with Sheila Pyrie's book, you know how the system of care structure can be set up. We have different levels. Our governance structure is our leadership team, and they meet every other month, and that's comprised of state agency directors. And you'll see the various representatives there. But if you look where you see the bolded things, those are where we have family and youth that are specifically engaged in this with the agency directors. Our family representatives are 3. They have voting rights the same as our agency directors, and their feedback and their comments really get us to a much better place and a much more authentic place. I think a lot of times we hear what a program's supposed to be, but our family members really bring it back to how they've experienced it and what their personal experience is in the system. Our next level, down from our leadership team level, I'd call that more of your management level. That's our planning group. It meets monthly. You'll see in bold there, we've got family organization directors who represent, and also youth representatives. It's also made of state agency deputies and program managers and providers. And then another emerging group that we also have that is in that management level is our statewide data group. It's also emerging as well as we have more data to analyze, particularly our grant data. For those of you who are, we all collect client level data. This is a place where we problem solve. We have family members that are on that group that talk about what the data means, what they're seeing in the data, what they have questions about. And then that last structure that you also see in a system of care is at service level. And we have families involved at that level as well. And they do things like provide the peer support for our high-fidelity wraparound teams, and also are collecting the data that we collect for our SAMHSA grant. So you'll also see in this next slide here, like we talked about, these people that meet, this is that governance level, and this, if you're familiar with Sheila Pyrie's book, that system of care book, then you have your system management level, and then you also have your service level. And we're going to focus on all of these where families are involved in, but when we think of governance in our world, we think of that top level and that second level too, because that's where families are really making the decisions about our system of care. That's where they're telling us what they want, what they need, and what direction we need to go. And this is just the size of the leadership team. It's about 14 members, and so we have a pretty high percentage of family members that are at the table with us at equal voice and voting rights. Our planning group, we have about 20 to 25 that attend regularly, and there are 3 family organizations that attend regularly and 1 youth representative. And our data group, our small emerging data group, you'll see the members there as well. The director of the Federation of Families, Gina Kaysen, with us. Parent peer support coordinator who's also doing data collection. And then you'll see that service level down there at the bottom that we talked about too. So with this, I'll turn it over to Gina Kaysen to talk to you all a little bit about how families and youth have been involved in various leadership positions in our system of care.
Okay. Thank you, Gwen. I just want to underscore how much we enjoy working together and moving our system toward a more family and youth-driven approach. And one of the ways that we've done that, we're going to talk about some of our examples with family and youth leadership. And the first one you see listed here is our logo. That may seem like a minor thing, but we went through great lengths to vet our logo with youth, families, and other stakeholders. We partnered with one of the marketing coordinators from a state agency to conduct a focus group with families and youth to identify the heart of what they felt was really important to convey in the logo. We considered various things, including the design being inclusive, so is it gender neutral, what about family composition, and ensuring that it was inviting. The initial group of families and youth made their recommendations, and a logo was designed based on their ideas. And this logo was then presented back to those same families and youth, as well as the planning and leadership teams that Gwen mentioned before. And we were all set to move forward with the logo. We felt good about it. And then we held some statewide focus groups with families and youth and received some different feedback. Simple things like color, maybe simplify some of the key elements. And we incorporated that feedback from the broader group and worked with a marketing firm to revise the logo and making sure that we kept those key elements that the initial group identified. And the reason that I went into just a little bit of detail about that process is I feel that it's an important example of broader family and youth voice and representation. It can be really easy to rely on the same family members and youth, but it's important to remember that their perspectives are diverse as well, and it could have made a really big difference in whether or not someone might have even called the system of care. The logo might have been stigmatizing, or maybe it didn't appeal to them, and so we just wanted to make sure we were being as inclusive in our design and perspectives as possible. So the statewide focus groups that we held were led by the communications work group, and the purpose was to present where we were with the system of care and get feedback on the development and messaging. And this really provided some valuable information that was used in how we designed the service array and the messaging, which included things like the logo, the website. The timing of messaging was something we got a lot of really great feedback from families and youth on, and we definitely use that to inform our approach moving forward. And then, as Gwen mentioned before, the planning group, which is that management level, has breakout work groups, and those work groups report findings and recommendations based on the charges to the planning group. And any feedback or other things that needed to be considered or fleshed out would then be presented to the planning group and then sent back to the work group to further develop. And then once that was ready to go, it would be presented to the leadership team to move forward with those recommendations. And all of our work groups were co-led by either a family or youth representative with a staff person of the system of care or a provider. For our annual conference, we have family members and youth who serve on the planning committee, and they help select the theme, the goals of the conference. They review proposals and select the presenters, and our workshops typically are co-presented with a family member or youth. Our satisfaction surveys, which we're really proud of, that are being used for our system of care, were selected by our outcomes measures work group, and all of those tools were reviewed by family members and youth. And the really important piece of that was what were meaningful outcomes to families and youth. We didn't just want to say this is what's out there, so let's use it. We really wanted to have in-depth conversations about what does it look like when you're doing well. What does it look like when your child is doing well, so that our outcomes meant something to families. Okay. And then thinking about cultural and linguistic considerations, we held a large kickoff training in 2015 that was very well attended. I think we had over 400 people. And then we held several regional trainings across the state of South Carolina. And then just this year we held another large summit on cultural and linguistic competency. And this focused on training around cultural bias, the trends and the needs of the LGBT community, as well as linguistic minorities. And so this is a really big focus to provide training to providers and families and youth in our state, and it's gone very well. And then in terms of representation, we have diverse representation in our system at all levels, whether it's service, management, policy level, and that not only includes stakeholders in terms of like systems, system partners, but also in the systems that families might have navigated or youth might have received services, and we see a lot with co-occurring disorders as well. And then one thing that we thought was kind of interesting as Gwen and I were preparing for our presentation, we noted that we didn't really have a lot of male representation in our system of care, and we didn't know if that was something that was common across other communities. And so if that's a similar experience, or if you have a totally different experience, we'd love to hear from you in the chat box. We'd love to hear what others are experiencing. Okay. Administrative support is really critical. It really helps all levels run smoothly and effectively, and we had staff support from our system of care to help the work groups be prepared, whether it's getting agendas ready, making copies, sending out email reminders, to help support the co-chairs and the members of that work group, and also to help family members and youth complete mileage and stipend forms, because we do value families and youth as experts and showed that through stipends and mileage reimbursement. And also many of the co-chairs of the work groups would, after a meeting, would sit down with family members and youth and make sure their mileage forms were filled out correctly, and then they would go ahead and, get it submitted for them. So we worked really closely with families to make sure they were getting properly compensated. And then many of you who have worked with youth extensively might know this from experience, but email is not the go-to method for youth. We might be used to using email to connect with other stakeholders and other partners. It might be a quick and easy way to get some information, but youth do not really check email very often, and so text messaging or some other SMS service, phone, social media really work best. But it's always good to just, ask young people in your community what's the best way for me to get in touch with you so that we can keep them engaged. And then I'm going to pass it back to Gwen.
All right, so for those of you out there who are also looking for other leadership opportunities for families and youth and other ways they can actually be making decisions in your system of care, one of the things that we really worked with was a request for proposals. This became much more challenging than I thought it ever would be. We wanted to have families and youth actually making the decisions for who would be getting awarded contracts under our grants. For those of you that are new grantees, first of all, congratulations. Second of all, as you get your contracts up and running, keep this in mind. One of the roadblocks we unexpectedly ran into was that our legal folks, we want to have families and youth at the table making decisions on the actual RFPs. But the problem is they weren't state agency employees. And because they weren't state employees, our legal department said, if there's a challenge, we won't be able to represent them. So we had a very unique and interesting and creative solution that was actually proposed by some of our stakeholders, and I was very impressed. We actually put a call out to our stakeholders and said, do you know of state employees in your agency who have been parents of youth in our system? And we were able to find, for example, a foster mom who was also a state employee. So that's how we got around that. So I would just encourage you, as you try to put families in the decision-making role, be creative. And when you think you have a solution like, oh, we'll just get them to sign a waiver, but you run into a roadblock, don't be afraid to think outside the box. We also found that our evaluation for you new grantees who are working on this, the data collection is unbelievably hands down better when it's done by family members. The face-to-face interviews with family members are more well received. They're much more, I think, meaningful to family members. And if you have yet to make that decision, I strongly encourage you to have family members do your data, individual client-level data collection. It's made all the difference for us. I'd also say, too, we have monthly webinars. We actually have family members co-present. They've presented on things like the Children's Mental Health Awareness Week and also on peer support. And then one thing that also, for those of you who are system administrators, We've really, it's funny, we've done some things, and we've realized that the policies and procedures sometimes that we do are not always family friendly, and so we try to make those family friendly, and one of the ways that we do that is by changing the wording, but we don't always ask families on the front end what do they want and what do they think. So that's what we've learned. That's what we've learned a great deal from, is having families on that front end when you're beginning to think through what that policy means and what that can look like. And so that's one thing I would just encourage you all as well. So just a quick little run-through checklist. Think about this. Are you having meeting times where families and youth can participate, like after 3:30, after school, or later in the workday? If they can't attend, is someone going out and seeking their feedback and meeting them where they are? Again, as Gina brought up, are you paying stipends and mileage and using those grant dollars to do that? And then how are you preparing family members to understand what's going on? Do they have a way that they can understand what these meetings are about and what you're expecting of them, and how to appropriately get their message communicated? And probably even more importantly, as a system person and as a staff person, how are you preparing the people who aren't probably used to listening to family members? How are you preparing them to listen? Are you helping them to understand what family and youth are going to be saying and how to respond appropriately to it? And then finally, one of the things we also had success with is if you were seeking application for a leadership position, did a family member or youth actually draft that application? Did they make sure it was in plain language so folks could understand it? So just the last slide, quickly for you all, just want to let you know here's some reference links. Reference links are here for you all if you want to be able to look at those. Also, I just want a parting shot in my last couple of minutes. Someone said to me, what's up with the palmetto tree? Why isn't the palmetto coordinated system affair? Well, our history is very interesting. The palmetto tree was actually used to make a fort back in Fort Moultrie in 1776, and the tree is actually very spongy. And the more and more I realized that the sponginess of kind of cannonballs and helped kind of turn the tide of the war, it was because they were resilient. That spongy material was bounced right back, and we really thought that's been a really good metaphor for what we want for families and youth. We want them to be resilient, to be able to be strong, and to be able to have that strength be their base of operation. And also, those palmetto trees, they thrive in really harsh conditions, and they bend without breaking, and that says a lot. So with that ends our presentation for South Carolina. I'm going to turn it over to my friends in Allegheny County and Aurelia Carter, and I'm looking forward to talking with y'all. Thank you.
Hi, thank you, Gwen and Jenna. This is Janine Rasky from Allegheny County, and hello from Pittsburgh, Pennsylvania. And I'm sorry, we're too close to this, so I have to say home of the Stanley Cup champions, Pittsburgh Penguins. I wanted to give you just a brief orientation to Allegheny County because we're a little different from the other jurisdictions. We are a county. We're the second most populous county next to Philadelphia of 67 counties in the state of Pennsylvania. Allegheny County includes the city of Pittsburgh proper and its surrounding neighborhoods. And as you can see from the photo, Pittsburgh's nestled between three rivers, the Allegheny and Monongahela, and it's the beginning of the Ohio River. It's an urban setting with 1.2 million residents, and we have about 537 households. At one time, Pittsburgh was had the highest number of elderly residents in the country. And that is changing as we've moved away from the steel industry, and technology and medical research has taken over in Pittsburgh. We have a younger population moving in, which we're really excited about. The median household income is about $53,000. It's a very ethnic-oriented town that communities are really clustered together ethnically. Diversity is not a very diverse community. It's probably about 81% Caucasian, 13% African American, and only 4% Hispanic. So our diversity is really in the ethnic groups that settled here during the steel mill that immigrated here to work in the mills. That just gives you a little sense of who we are and what our background is. I want to talk a minute about our history with the system of care, and you'll see our governance structure has been sustained through what you're going to hear. In 1979, the Department of Human Services was created, and we have the luxury of being a Department of Human Services and having everything under one umbrella. So we are working with the area on aging, drug and alcohol, mental health, child welfare, intellectual disabilities, and community services all fall under one director. So working cross systems for us is a lot simpler than most jurisdictions. It's very integrated at many levels. In 1998, we got our first SAMHSA award of our first Community Connections for Families SAMHSA grant. And that really focused on young people with that grant. And from that grant, we hired our first family support specialist and 5 additional specialists to support families in the target communities. In 2002, we got a second grant. It was Partnership for Youth Transition. Those were the teenagers. And more family support partners or family support specialists were hired to support the families of transition-age youth. The first youth support specialist was hired under the PYT grant, and that was important for us, but lessons learned is we hired one. We learned very quickly that the support necessary for that youth and that family engagement needed to be much more robust. In 2004, with the startup funding from the county, Allegheny Family Network was formed. That's our family-run organization. They became their own independent 501c3 organization, and they are truly a backbone of our governance moving forward and a very key player in a lot of the policies and administrative decisions that are made within the Department of Human Services. They impact those decision-making. In 2005, we were awarded the third System of Care grant. It was a Starting Early Together. It was a birth to 6-year-old grant. And then we also were working closely with the High Fidelity Wraparound, and we piloted our first youth support partner. And our youth support partners are alumni of the systems, and they are either current or former recipients of services of the child serving systems in Allegheny County. Youth support partners then grew. We started with 4, and we currently have funding for 40 youth support partners. And they are such an important, integral part of what we are doing today. We recently, in 2016, have been awarded a 4th Systems of Care Expansion Sustainability Grant, and we're looking at infrastructure and developing a community of practice to provide easy and timely access to behavioral health services for families involved with child welfare. Moving on to the structure that we have. Our Children's Cabinet is our main advisory board, but making up that is, and complementing the work that's being done and feeding into that board is CITY. It's our System Improvements for Youth, our Youth Advisory Board, and that is made up of a number of young people from across systems: behavioral health, intellectual disabilities, child welfare, juvenile justice. We also have our Youth Support Partner Unit that I spoke about, where we've hired 40 alumni and then have hired 10 administrative supports for that. So it's an organization of about 50 people and growing. Allegheny Family Network is our family-run organization. Again, they are key core members of our advisory board. And the Collaborative for Mental Health Advocacy is a partnership between Allegheny Family Network and NAMI of Southwest Pennsylvania, are really kind of the foundational pieces of our advisory board. And then we have on the Children's Cabinet, it's a rolling membership, and it's a quarterly meeting. It averages about 30 to 50 people. Adding to those core groups are many youth. When I say many, we could have 10 at a time at these meetings. Family members are there. We can have 5 to 10 families at every meeting. The health department, Department of Ed is there, our managed care organization. We have contracted providers there, probation, the courts, judges. It's a well represented group of people and body who are sharing information and assisting with some decision making moving forward. As you can see, the other members on the list. I'm going to turn it over now to Aurelia to give you some conversation about the family and youth leadership.
Hi, good afternoon, everyone. I want to talk a little bit about our family and youth leadership in Allegheny County. There's always been a commitment. Janine talked about all the SAMHSA system of care grants that we've had. We've been very thankful and privileged to be able to have them. And in that came with that whole commitment. Once we started to have family positions, as we continue to get grants, we continue to increase that. And again, we moved on to have our family organization, Allegheny Family Network. Currently, right now, because there's a commitment to family leadership from the grassroots level within the community all the way up to policy, we currently in the Department of Human Services have myself, which is a family support specialist, and I've been here for over the course of the 3 grants, now going into 4. And we also have a family evaluator that was hired in 2010, and she sits in the Office of Data Analysis, Research, and Evaluation. Thank you, Janine. It's a long acronym. And Janine talked a little bit about our family organization, Allegheny Family Network, whom we are very proud of. They are a family-run 501c3. Again, all of the folks that are hired, the family members, are the ones that have lived experiences and support other family members. What I like to really emphasize with Allegheny Family Network, it is just not per se parents, if you will. They break it out a whole lot based on groups and based on experience. They have dad's groups. They have dad support partners, or they're called father support partners. They have grandparents groups. I mean, just the whole array. And we really try to make sure, excuse me, in Allegheny County, any supports that are provided to families, it's across the county. And when you think in terms of Pittsburgh being sort of the urban part where it's, in some regards, it's a lot more resource rich, we also have family members that within Allegheny County that live sort of more in the urban or suburban areas, which oftentimes travel is a big issue, trying to get to and from and being connected to services or getting to services. So Allegheny Family Network does a really good job spreading its wings in reference to serving families throughout Allegheny County. And Janine talked about the youth support partners, and again, we're very happy to have them. Just having that youth voice at the table is so critical and important, and in the ways that they support other youth. We also have NAMI, and Janine talked a little bit about NAMI, and that is our other family organization that's really focused more so on family members who have adult loved ones with a mental illness. Our family and youth positions are involved in everything, including data-related trainings where they're learning about evaluation, reading data, understanding it, and being prepared to come to a lot of our advisory board meetings. And as people are talking about different things related to data, they're really on top of things. We also have positions within our positions. They also do support family members going to court, which oftentimes is a really big and scary thing for them, whether they're involved in the child welfare system or their kids have had some kind of juvenile experience. And we also, when we think in regards to family and youth leadership, one other thing that we do very well in Allegheny County that I really like to talk about is that we also have family and youth who present to police officers, which is really a new thing but an important thing. And they get a chance to talk with them about what do you do, how do you engage people who have a mental illness, whether it be the family members themselves or if there's a crisis situation. And they give them a lot of good feedback around that whole engagement piece. So again, we're kind of proud of all the things we've done so far when it comes to that kind of leadership within Allegheny County when it comes to family and youth. And when you just talk about cultural, linguistic competency and diversity considerations, again, in Allegheny County, we really do strive to try to make sure everything that we do, it is diverse. And when I say diverse, it's not just having a couple people based on race sitting at a table. It is truly, we want to be very reflectful in our committees and any advisory boards based on population. And there are just some of our advisory boards and committees that are listed on the slide there. In particular, we have a mental health and intellectual disability advisory board. We have a drug and alcohol planning committee. Again, we try to make sure that when we think in terms of diversity, and not just with race, we want to make sure that our families and our youth are involved on these kind of advisory boards and planning committees. And you also see that we have our SOC initiative that's connected with our LGBTQI community. I'm not sure if there's another a letter that should go on there anymore. I'm not really that up to date as I should be. And we also do have a diversity officer within our children, youth, and families division. And we even though we're not that extremely diverse when it comes to race in particular, more and more we're seeing that we're having a lot more immigrants and internationals moving into Pittsburgh and Allegheny County, and we're very happy about that. And we do have an initiative that's focused really on that population. So it's really nice to see Allegheny County and Pittsburgh, we are considered welcoming communities. So we welcome everyone. So we're glad to have that initiative. And they really do focus on sharing resources, making people feel welcome, and also policies to ensure that we make sure that they're always included in everything that goes on in Allegheny County and in Pittsburgh. And the other group that I like to talk about is our MO group, Multicultural Outreach and Education. And this is a group of African American women who put this together over 20 years ago, and they have a conference every year that everybody really gets excited about because it's focused on recovery. It's focused on recovery for everyone. In particular, again, it's welcoming, engaging. They have over 250 people, 250 to 300 people that attend this conference every year, and it is consumer-driven and consumer-run.
So all of these folks have at some point been part of our governing body and our children's cabinet. And when we talk about the roles and responsibility, I think the role of the cabinet members is to really ensure full representation exists. And then to review the materials that we bring forward, to provide appropriate feedback, and most importantly is to be present in the moment, listen, speak, and be heard, bring the relevant issues forward. That's one of the things that we really encourage. And I have to say, Mark Turner is the director of the Department of Human Services, and that's where he starts every meeting with what do the families think, what do the youth think. We know what we do. Who else can better inform us than those who have lived the experience? So he really values and their input and acts upon it. And that's the most important part, is acting upon what is spoken in your governance body. Part of those meetings are used to strategize and communicate effectively. The reporting back to their jurisdictions is important. One of the other key successes to our governance body over all this time has been that we made the appropriate accommodations, and part of that is prepping folks for those meetings, ensuring that what's going to be presented is in a language that they understand, at a level of understanding that they can comprehend and feel that they can communicate back what their hopes and dreams and wishes are moving forward. Child care, sound systems, interpreters, all of that needs to be part of that responsibility of that governing body to make sure it's in place so that the meeting is successful. I think moving forward, the administrative support is a lot of what I just said about having the supports there for the meeting, And the empowerment of the governing body starts from the top down and bottom up. Everyone's an equal party. Everyone has an equal vote and say in our meetings, and that's important. And every opinion is respected. Endorsement of the value added from administrators fosters the replication and implementation. We have the impact of our youth and our family members has been so strong. They have standing in court. So they've been well-informed, trained effectively, and strong enough that they have a strong enough voice and a strong enough body and a presence in these meetings and impact our system. So we want to encourage in your governance bodies to ensure that there are the cross-systems representation and equal representation for your area.
So continuing on, just to think in regards to what are our lessons learned based on governance and how we continue to move forward and do better. It is very important, we've learned, to be patient. It is highly a worthwhile effort. In particular, less stress for people equals or will mean that things will work a lot better and a lot smoother. It is very, very important, as we learned and continue to learn, that you have to continue to remove barriers for family and youth to participate, whether it be time. I talked a little bit about location and transportation as being issues, especially in Allegheny County. Again, city of Pittsburgh, outside surrounding more so suburban, transportation becomes an issue. Some of our folks have to catch a bus or catch a couple buses, maybe even 3 at times. And, we need to be mindful and planful to remove those kind of barriers so that people can fully participate. Child care is always an issue when you're asking family members and also youth. A lot of our youth have kids of their own. That's an issue, and we need to remove those barriers. Here in Allegheny County, we make sure when we have meetings, we have child care to alleviate that barrier. I just really want to emphasize that although you can remove barriers, what we've learned is over a period of time, you have to go back and relook. Sometimes you remove some barriers, but then these others creep up that would prohibit participation. And you've got to continue to ask family and youth, what do they need? It's about their voice and what's important. What would it take in order to have you to participate? Are there any barriers that you see or that you've heard? Ensure adequate preparation for youth and families. We do this all the time with all of our meetings. We constantly will review an agenda with family members. Oftentimes we will have one-on-one conversations.
Before and after.
Yes, before and after. In particular, when these are new family members and new youth that are being invited to the table to participate, we want full participation, and that means that we need to set out the time, and we do, in order to adequately prepare them. And again, around providing compensation to demonstrate value of expertise, that is very critical and important, and we believe in that in Allegheny County. And not only that, that's a simple way to say thank you as well. Their time is very valuable, just like ours, and we want to show them how much we appreciate them. And hear and act on what is being said. Family members and youth, they watch all the time. I'm a firm believer, and I know as well as the other family folks that work here in Allegheny County, we want to be sure that what family members have to say is valued, and our family members will let you know. They are watching what you do, so please hear and act on, what you say you're going to do. That also, builds on your reputation. Again, you can't build leaders and champions if there is no trust. So that is critical and important. And again, our families, they will oftentimes just tell us to be sure we heard. That's important. Trust is important, and we're watching. So based on what you're telling us, we're going to watch and see what you do. And that's it for us.
We have some reference links if you're interested in seeing or learning more about the Youth Support Partners. They are, again, the young people that we hire as full-time employees to come alongside youth to support them in the system. And you'll see here some other resources available to you. So I'm going to turn over the next piece to Rachel.
Great, thank you. This is Rachel Ludwig. I'm from Chautauqua Tapestry in Chautauqua, New York. And there have been some great similarities and themes I've heard over the last couple presentations, so I'm going to go a little more quickly through my slides. I echo in that I appreciate the opportunity to be part of the presentation and to share a bit about the governance of Chautauqua Tapestry. So you'll see here, this is Chautauqua County, New York, and you can see the 62 counties, and we are way over here in the far left, the farthest western county in New York State, and we're bordered by Erie County, PA to the south, and Erie County, New York to the north. There are 62 counties in New York, and the size of our county is about 1,060 square miles, just to put it into perspective. And you can see in the middle bottom here the towns and villages, and the logo of Chautauqua Tapestry, as you can see, is the shape of the county. And then it has the tapestry theme to note the weaving together of supports and services. Chautauqua County is actually part of northern Appalachia, and the term Appalachia is used to describe a cultural region in eastern United States that's characterized by poverty, the lack of education, and difficulty accessing health care. And based on income and poverty data, Chautauqua County is one of the poorest counties in New York, and it's ranked 54th out of the 62 counties. We have two main cities, Jamestown and Dunkirk, and that's about where half the population reside. The county population is about 130,000, and looking at that vast geographic area of the county, coupled with the fact that almost half of the residents are within the cities and the rest are spread throughout the rural areas, you can imagine there are transportation and access challenges. We also have limited racial and ethnic diversity, even less diverse than Pittsburgh in Chautauqua County, with about 92% of the population being white, 6% Hispanic, which 78% of the Hispanic population are Puerto Rican, followed by 11% Mexican, African American 2%, and our other diversity comes from, there are 2 Seneca Nation reservations in the region, and there's actually a long established Amish community in our county as well. So here are some fun facts about Chautauqua County. We are home to the historic Chautauqua Institution. You can see in the left top photo the Anthony M. Hotel, which is part of the institution, was built in 1881. We have a 9-week season of educational cultural programs every summer. And the reason I want to bring this up is because I mentioned our population is 130,000, and 100,000 people, local, national, and international visitors, come to Chautauqua every year. So it's a big impact on our county. Also, we're the birthplace of Emmy Award-winning actress and comedian Lucille Ball, and there's a museum in Jamestown to celebrate her. There's an annual comedy festival, and it's now growing into a national comedy center. So maybe you can come and visit and come and laugh with us. And we also have gorgeous sunsets on Chautauqua Lake, so you can see an example of one there. In 2008, the Chautauqua County Department of Mental Hygiene was the recipient of a 6-year SAMHSA cooperative agreement, and we use that term title, Chautauqua Tapestry. And in 2015, a 4-year expansion application was approved, and now we are in our 2nd year of the Tapestry Expansion Initiative. And I've had the privilege of being the project director of Tapestry since 2008. Our expansion goals build on the system enhancements, creating wide-scale adoption of system of care approach. The governance body of Tapestry has long local roots, but as they're changing slides here, let me go back. You can see that the history in New York State as well has long roots at establishing system of care, dating back even to the 1984, 1990s. And I think it's important to specifically note the impact of the CASP program, which is the Child and Adolescent Service System program. CASP was really integral in establishing system of care values in our state, as with Pennsylvania. That CASP program was the first federal program that was organized to holistically address children's mental health. And from the foundation, many communities, counties had the structure that was needed to really apply for and receive funds from SAMHSA through the Children's Mental Health Initiative agreements. The agreements have been awarded now in New York State to 12 communities, and the state has recently been awarded the second of 2 4-year awards, and that's called New York Achieve, and that's also an expansion award. The timing, I think, of the CCSI, the Coordinated Children's Services Initiative, times right along with the system of care. You can see it's all kind of in the same track, which is very appropriate. The same timeline of success, so that's how I like to say it. CCSI created this 3-tiered structure that includes a local direct practice level, a county cross-system leadership level, and a state cross-system leadership level. And the initiative embraced the CASP principles and really looked to operationalize those concepts. And in 2002, as you can see on this slide, CCSI was actually signed into law by the governor at the time, Governor Pataki. So you'll see here on the next slide a list of partners that it took to really commit to making these changes in order to change the system of care as it is. There's a list of several. I had to spell out all the names, so I apologize if the writing is a little small on this slide. But as you can see, it takes the commissioner level involvement to have the buy-in that lasts, I think, as long as it has in our state, and also for sustainability's sake to move forward from that point. So again, you see that 2007, the council commissioners met. In 2008, the first children's plan was developed. It's had a couple updates. But I think it's important to note here that with the 3 structures, here's how it looked in Chautauqua. So in 2002, you see that there was a requirement there to establish the different tiers. And you look at the state level, but also noting that there's a need for a local level and for the family level, which I think is so very important. There are also some regional teams, and that's really to make sure that communication exists between the tiers. So we sometimes refer to it as tier 2.5, just to kind of keep things in perspective. So this is tier 2 in terms of structuring. It's our governance level. So as we're talking about the way that governance works in systems of care, for us, it's really at the tier 2 level. Tier 2 exists prior to having any terms of system of care dollars in our county, but it really has been great in structuring how we work together, how we talk about barriers and bridges. It's a location that provides a format for hearing family stories as well as state changes. So really bridging between the family level and the state level to make sure that there's communication that flows back and forth. You can see that there's leadership there from the local departments of mental hygiene and health and human services, juvenile justice. We have county legislators. We have family members and youth members along with community partners from private mental health providers. We do use the conversations at Tier 2 to report to the mental health subcommittee, which is part of the state or the county government. So I think that's important too, because we're communicating not only to the community leaders, but also then to the acronym there, RTACs, the Regional Technical Assistance Centers. So Tier 2 has that strategic planning function. There's recommendations for funding, and that's not only system of care dollars, but funding looking for which applications are appropriate for the community, timing appropriateness. And Tier 2 represents the community looking at the concerns and also creating that opportunity to resolve some of those concerns and create the bridges. Tier 1 level is where the family teams are, so this includes our high fidelity wraparound, but also family teams really it's really important to emphasize that an individual approach be part of all the work that's done with families. It's really with families, not to families. And there's a description there of team composition, but I'm sure you're familiar with high fidelity wraparound and teams. And if not, there are certainly some references that have been provided already in this webinar, and I hope through others as well. We do look at all levels really for that family and youth leadership. I love the example of presenting to police as well, and I think we've used our crisis intervention team training for family members to have that opportunity. And I like that as an example of not only affecting the local level, this Tier 1 level, but also Tier 2 level and potentially even the state level. I think that's a great example. There's some lessons learned from our community. We do use stipends as well, and we are looking at ways of really invigorating the way that we have family leadership among our, not only our Tier 2, but we have many family members that are on advisory committees and planning committees, and we want to make sure that that continues, and it's not always through stipends, but through the rewards. I think the fact of listening and involving and responding to family members, just as you do all the professionals, I think it's very important. I think it's important to note that the long history of tiers is a benefit in many ways, but as I mentioned, we've been funded as a system of care initiative since 2008, so we know that the reinvigoration efforts are needed. We've recently looked back at the bylaws that were originally drafted for Chautauqua Tapestry in 2010, and we need to update those because there's a change not only in the structure of our cooperative agreement, but in the community as well. So we try to be really conscious at all levels to get participation, and that's appropriate, and that will continue to guide us towards sustainability. We do a lot of train the trainer models, and that's our governance has been very clear that we want sustainability, and service expansion that's done is all done in a way that's focused on sustainability. So I think that's important as well. And I think as we're hearing examples today, it's very helpful. We can all learn from one another, and I certainly appreciate the input from other presenters. And with that, I will share a few references, and they'll be in your PowerPoint, and turn it right over to Julie from Cherokee Nation.
Hello, this is Julie. I'm really grateful to be here today and share with you some of the things we're doing at Cherokee Nation. So thank you for bearing with us. This is we're getting to the end of our presentation. I talk really fast. I'll try to slow down, but also keep in mind that we want to leave some room for some questions. So starting with Cherokee Nation, unlike some of the other presenters, we haven't had systems of care very long in the really big scheme of things. This is the first time Cherokee Nation has ever received a systems of care grant. We were an off-the-shelf grant as well, so we really didn't get funding until 2013 and did a lot of planning and really didn't get things off the ground until 2014. So let me give you a little information about Cherokee Nation to give you some context of where we're coming from. So with Cherokee Nation, we highlight this Oklahoma, and we're in the northeast part of Oklahoma. We have over 9,000 square miles in our tribal jurisdiction service area. That is not a reservation. Cherokee Nation in Oklahoma, we don't have reservations in Oklahoma, so it's we have concurrent jurisdictions, but we're intermingled with the regular population. So it's like a checkerboard that makes it look easier, but that's our service area, and that's the service area that we wanted to serve with systems of care when applying for this funding. We have, of course, 340,000 citizens, largest tribe in the U.S. at the current time. We kind of go back and forth with Navajo Nation. We have over $1 billion annual economic impact for the state, and we have over 11,000 employees within Cherokee Nation. We have, in addition, so our tribal structure with Cherokee Nation is we have a tripartite government. We have a principal chief, we have a deputy principal chief, and then we have his officers, and those are on the slide. You can see the listed officers. We also, from those officers, we also have executive directors that run the different groups within Cherokee Nation, quite large. Cherokee Nation is housed, so the primary office is out of Tahlequah, our capital, and then we have different offices throughout our 14 counties. Lost my thing. Okay, so next is also for our judicial branch. We'll start with that. It was established in 1822. We have 5 justices of the Supreme Court and 2 district court judges. Those are the terms that we serve, and they're nominated by the principal chief and confirmed by the tribal council. Also, after our next one is our legislation branch. So we have 17 tribal counselors that serve staggered terms of 4 years, and they serve each of our districts within our 14 counties. This will come into play later. I wanted to talk about this a little just to give you guys an idea of how we're working with our citizens of care, because the council has their purpose and they're elected, in staggered terms, and so trying to partner with our council has been one of our challenges, and we'll get into that a little bit later. This is the structure of how Cherokee Nation is overall. If I were to give you what the org chart looks like, you have the judicial branch, the principal chief is with the executive branch, and then you have the legislative. We're housed, if you look into where the different parts of Cherokee Nation for our systems of care, we come out of, we're under the chief of staff, under health services. We're tiny, basically. I just wanted to give you that perspective of where we're starting with our systems of care. We are, the HERO project arises out of the health services, and so we have 8 clinics and 1 big hospital. We have over 130,000 patients. We're accredited with DNB, and it's 58% of Cherokee Nation's workforce is our health services. So we're quite large, even though we look like we're tiny within a big array of Cherokee Nation. We're actually quite large in our services for health. Also, the HERO project. Let me start with this. So Cherokee Nation HERO project, we did not have children's behavioral health before Systems of Care funding. What we had before was we had behavioral health that served adults. So when we got the Systems of Care money, we looked at it as seed money to start Systems of Care and to expand Systems of Care throughout the rest of the Cherokee Nation. So that was quite, a big challenge that we set for ourselves when we wrote for this funding, was to build a Systems of Care from scratch, from the ground up. And so when we developed the HERO project, we wanted to really focus on the 0 to 21 population within Cherokee Nation. The HERO project is serving a population that has never been served by Cherokee Nation, which is our children. And in the past for behavioral health, what we did was we had refer out to other agencies, state agencies within our jurisdiction area, which, let me tell you, I come from Indian Child Welfare before I moved over here, and finding services and resources for our children with behavioral health problems. First of all, we didn't know much about behavioral health, and so we didn't know really anything in child welfare, and so we were just referring out. And so what we wanted to do was create, to fill this gap of service, which was ginormous because we did not have those services. So it was very, very intense work in the beginning of getting this set up, because we knew what we wanted to do, and getting there was going to be a challenge. So here's our values, what we wanted to do with the HERO project. Of course, it's very comprehensive, and we want to serve our children and systems of care at every level, not just the micro level. We wanted the meso level, and we wanted the macro level. So our values, we hold these very, very dear to us, and we train all of our employees who come to the HERO project on these values. This is how we created a culture of our systems of care in our workforce. So those are our values that we really hold dear to us. Next, when we started off with our governance structure, I'm going to focus specifically on the Children's Cabinet today. Don't have time to go into all the different things that we do, but the Children's Cabinet is the part that governs what we want to do with our systems of care. And so in the beginning, we had made an attempt to do a cabinet. However, we didn't have enough yet. So we had to put the cabinet on hold until we had to go back and get our family service organizations trained in systems of care. And actually, we didn't have any family service organizations in our area to even partner with. So we had to go build them. So we had to take it a step farther and start, using community organizing, mobilizing tactics. We had to build these organizations with our families, doing one-on-one meetings, having house meetings, and teaching them about systems of care, about social emotional development, and really educating on the stuff that we knew in order to empower our parents to do this. So we had to go back and develop them. Once we got them developed, now we have one in particular family-run organization that is now their own 501c3. They're completely run, independently organized now. We got to step out of that. We're still there as a partner, but we're no longer running their program. They're doing it themselves. And so they have fed into all of the work that we do for systems of care at the HERO project. And so one of the things that we started with, after we were able to get those up and running, then we went back and started over with the Cherokee Nation Cabinet for Children and Families. This did not exist. Nothing like this existed within Cherokee Nation before systems of care. So we had organizations, and they would have work group meetings, and I've been with the Cherokee Nation for almost 18 years. And going backwards, we would do work groups, but they would fall apart. They weren't very sustainable. They had great ideas, and people would come, they talk, but no work ever really got accomplished except for they might have a brief, or but nothing really, and it would just fall apart. So I really did not want that to happen with our cabinet. So we had to go strategize a little bit differently. Instead of just calling a meeting, we had to go out and kind of similar to how we built the family-run organization, we had to go back and start and do one-on-ones and start meeting with department heads at Cherokee Nation. Because let me tell you, we were siloed at Cherokee Nation. I did not know what programs were existing at Cherokee Nation. They did not know what we were doing. Because we're so large, we did not know what each group was going. So our goal for the cabinet was to change that. And so you're looking at a picture that we did recently. The cabinet worked on bringing together a proclamation put forth through our executive branch by the chief. The chief is right there in the center signing the proclamation, giving power basically to our children's cabinet around the activities and things that we wanted to do. So we were pretty happy and proud of that. And we did this during our Children's Mental Health Awareness Month, for last month. So here's the purpose of our cabinet. So our purpose is to address policies and barriers that impede children and families' ability to access quality services. Our objectives are pretty clear-cut. A lot of the things, as what the other presenters had presented, was increased collaboration across our departments, advocacy for shared governance across systems concerning tribal families and youth, promote shared outcomes across systems reflecting tribal community values, promote holistic approach to family and children's services, integrate best practices. We wanted to emphasize quality standards for existing family programs. Let me tell you, evaluation just wasn't done in our family service programs, period. So through the cabinet, we're educating our program directors around evaluation and what that looks like. We also wanted to advocate for youth voice and choice in programs specific to tribal youth, address new and emerging issues concerning family and children's services. Another thing that we had to do in order to meet some of these objectives, we also had to develop a youth move group. And so we did, and our youth move became official earlier this year. So now they're a big part of our children's cabinet and doing a lot of work with other tribal youth groups at Cherokee Nation. So we're in the beginning stages. We're getting the ball rolling. And so some really great things have been happening within the last year. So here's our membership size. It looks quite large. These are the different members that, I don't know if you can see that kind of tight because I had to try to fit everyone in there. But these are just different similarities you've seen from the other participants of, who's a part of our membership. These are all residing through our 14 counties tribal service jurisdiction area. Our members will consist at least 10, but not more than 30 agency members. We also have like a big representation from our family-run organizations as well as our youth move. They're all, again, very similar to the others, is that they all have equal voice. We spent a lot of time educating our children's cabinet. And let me tell you, they did not understand really what exactly systems of care was. So we spent a lot of time in the beginning educating around systems of care and educating around social emotional health, mental health. We talk about stigma, we talked about evaluation, and every time we meet once a month, but every time we meet, we always have a training presentation around what we know and what we're wanting the cabinet to be aware of. So it's just a piece that we do. So roles and responsibilities, the cabinet meets once a month. We also have work groups within the cabinet. And the work groups have been important. And let me tell you, because again, from what I said earlier, I didn't want just another work group that had some great ideas and that fell apart. And I know from past experiences with getting our family-run organizations up and running, they had to see change. They had to see progress of the work they're doing, because why else would you want to keep coming to a meeting? We want part of the retention activities of those meetings was to show progress and that we were actually doing something. So these work groups were crucial in the beginning to do that. And some of the progress that has been created because of these work groups, the cabinet has already accomplished these things just in the short time that they've been in. But the first thing was integration of behavioral health into primary care. That was a work group created by members of the cabinet, and because of that work group, we now have co-location of behavioral health into our primary care settings. We also have screenings and assessments. Now, we always had developmental assessments, but we wanted to add a social emotional screener to all of our well child visits. But because of the cabinet, now that's happening. So every child who comes to Cherokee Nation for a visit, for a well child visit, gets a social emotional screener called the SWIC. It's now integrated from 0 to 5 into the hospital, so they get that every time. And now, because we're co-located, we're able to call every single positive SWIC. And it's been amazing. The families love this part. So that's a huge accomplishment of the cabinet, was getting that done, getting our electronic health record to integrate components of the SWIC into the electronic health record, so it's shared across all of the people involved in that. So another thing is the integration now. We're integrating now into child welfare because of the cabinet. That's another thing that's been accomplished. So they've accomplished so many things already that's been really, and we really, at Hero Project, we're facilitating these groups, but the ideas are coming from the cabinet, and they're solving the problems. We're there to facilitate, educate, and be a part of the problem solving, and to how to get all of these groups who don't know about each other to finally collaborating, creating that systems of care, and really starting to get these families aware of services. And there's a big project now underway within our family groups to create a secret shopper. So what they're wanting to do now is go in and test these services and see how they're doing. So a person comes into Cherokee Nation, they might have a question about, how do I get services for my child who's sick, or how do I get behavioral health services for my grandfather or my granddaughter, or how do I get services for food. So now we're going to test, our families are wanting to test those processes, specifically, and see where we're falling apart, and if those services are able to meet their needs. So they're really just taking it further and further as we go along. We have an executive committee meets as needed. These represent the cabinet between meetings. It is comprised of the cabinet advisory board. Here's our advisory representatives, and they serve 1-year terms. Of course, we have the committee co-chair, the legislative co-chair, health co-chair, parent caregiver co-chair, youth co-chair, and the secretary. Right now, the Hero Project is representing the secretary piece to maintain minutes and to keep things moving along. As far as our family and youth leadership culture, like I said earlier, we had to go back and create these family-run organizations to help get this going. Because we did have family advocates in the community, but it wasn't very well organized. So because of the organizations that we've been able to do within our counties, we have 4 family-run organizations now throughout through 4 of our counties, and they're the ones, like I said, that really teach us what we want to do within our children's cabinet and what we want to do with systems of care. Some of the things that they have done for the family is they have now, every year they do what's called Empowering Parent Summit. They came up with a name, and they developed a curriculum of what they wanted to do. And so the summit is it's a training conference, but it's for parents and family members, caregivers, grandparents, and they developed the curriculum, and we come in and help train. Some of the things they train parents on in these conferences are regarding autism. We're talking about the IEP meetings. A lot of parents have questions around those. It's around parenting strategies, supportive services, mental health. All of those different topics they've created workshops, and then we have this once a year so far. And we've had 2 in 2 different areas of our tribal service jurisdiction area. So that's been going really, really well. So they're a huge, huge lead and influence everything that we do at the Hero Project. As far as the cultural linguistic component, culture is integrated into all aspects of Cherokee Nation. All of our staff are tribal members. That's part of Cherokee Nation hiring preference, is that we are the first place preference for hiring is that you're a tribal member. So, of course, every member of the cabinet represents cultural outreach, and also we have a cultural outreach in particular that specifically addresses culture, and they're actually also a big member of our children's cabinet, and really is integrated in everything that we do in the cabinet. As far as administrative support, with the Hero Project, we provide the administrative support for the cabinet, like I said, by 19 minutes of the board and distributing copies to the members. We also do a newsletter. We send that out to the members every month. We're also providing training. Again, some examples are ACEs, trauma, early brain development systems, SOC values and philosophy. It's not just something that we say. We believe in systems of care. It's what's really been a huge change agent at Cherokee Nation within the last couple of years, and we could not have gotten any of this done without our partners. And so part of that has been really incorporating our partnerships. We can't do it alone. And so, when we have been able to incorporate this, that's been hugely impactful. And also, the lessons that we've learned, like I said, we started from the bottom up, and the reason we did that It's because I wanted input from those ground level providers who are in there working with families through either primary care, maybe through child welfare. Those people have been working with families from the beginning, and so we had to have their involvement and their we wanted them especially involved, because it's not going to work unless providers believe in this too. So yes, you can go to the top and go incorporate that, but I wanted to start from the bottom and have them talk to their bosses about it and go from there. And that's really what we did, doing the one-on-one interviews, talking to them. How's your program? What do you think about it? Is it serving your families? You know what your outcomes are? Starting with those questions and really quickly building relationships. Relationships was key. Oh my goodness, if we did not have the partnerships with our relationships with our pediatrics, we never would have got the things done with integration. We had to build that, and that took some time. That definitely have patience when you're doing this type of work, because for me, I get impatient and I want to just get it done. This is a good idea. Everyone should just believe in this, and we go from here. But no, you have to really incorporate understanding and build that relationship, and it's so strong. Our biggest partnerships have come from the cabinet, and the relationships they help, with the advocacy at the tribal council level. Tribal council has a lot of issues that go on, and just me alone asking them for help wasn't enough. And so using the cabinet voice, that has finally gotten attention of the tribal council to say, hey, this is a good idea. Maybe we should pass some resolutions around children's mental health and systems of care. So that's been huge for us. Do not let members drop off. We had to put in a retention plan before we even started. That was what that looks like for us. So we have meetings every month. Because we're moving so fast, we had to have meetings quicker. And between those meetings, we had some cabinet members. They get really busy. These are like directors and program administrators are very, very, very busy. So in keeping them, making them aware that we're not going to go away. We do this work group. We're not going to go away. We're going to be here. So let's, keep going. Also, strategic plans needs to be fluid. Don't be afraid to go back and change it. Sustainability is more than just funding. It's ideas and the way we think, and training. So hopefully I didn't take too much time, but I'm going to turn it back over. Here's some of the links that we have. Thank you.
Great. Thank you, Julie, and thank you, everybody else, for energetic and enthusiastic presentations. Very much appreciated. Here's the presenter contact for everybody who presented this afternoon or this morning, if you're joining us on the West Coast. We have one question so far coming in, and that is from Monique, and it is for Aurelia. And it's specifically, how can we get more information about the Mo conference?
Actually, if you send me an email, I'll be happy to put you in contact with folks, as well as I'll get information for you that could be shared.
Great. Thank you, Aurelia. And so it's Aurelia Carter there, Monique, right on that screen, and you can reach out to her directly. Beth has a question.
I do. One of the things that we've learned about system of care expansion is that the system change at the state level is not enough, and system change at the local level is not enough, that it really is that bidirectional partnership that makes a difference. And in the Cherokee Nation, Julie, you were talking about bottom up and top down, and I think that reflects the same sentiment. And Chautauqua, you addressed this in terms of the tiers, where there's a structure at the state level, a structure locally, and family. I'm wondering, since we have presenters that have statewide grants and then a couple of county grants, how, if any of you can talk about how you solidify those partnerships in your structures and in your work so that you can leverage change at both the state level and the local level to work together. Somebody want to take that? Maybe Gwen, would you like to start?
Okay, pick on me. Thanks, Beth. I think I'll be very honest, Beth. I think this is the thing probably we've struggled with most with our system of care, because our system of care grants go back to the early 90s, and they were county-based or community-based. And I think with the shift that we saw, some that in some grantees that you need to have it statewide so you get those funding structures aligned, you can get the statewide resources to align. But we haven't, I'll say we haven't. We continue to work and to continue to struggle with that that county community base meeting with the state base. And I think our work that we've done, at least in our system of care now, has been to try to get the funding structures aligned, to get the Medicaid programs aligned, and really hoping that we'll be able to facilitate some of the things that need to be done at the local level. But it's a great point, and I really think it's something that you've got to have both. It really is both.
Yeah. Thanks, Gwen. What about Allegheny? Does one of you want to address how you work that out in Pennsylvania? Aurelia or Janine?
Can you hear me?
Yes.
Hello?
You're a little bit far away, Janine.
Okay, can you hear me now?
A little bit better, yep. Thank you.
Okay, so the question, I'm sorry, is that how do we make the bridge with the state and the local?
Right. How do you navigate that partnership so that changes can occur at the state level to support your work and locally to support the state's work for expansion?
It really is in the communication and the inclusion, being part of those work groups, volunteering to be part of those work groups, moving forward, pushing the local agenda into the state agenda and vice versa, bringing it back to the local community. We have representation at both levels, so we volunteer a lot to be sit on those state committees and be heard at the state committees. And we invite the state folks into our meetings as well.
Okay.
And
So
this is Aurelia, and we do also have family and youth involved in that as well.
Okay. Rachel, can you address briefly how those two tiers, the tier 2 and 3, work together?
Well, I think one of the examples is if you have success at any of the levels, or even another community has done something that reflects a change in state policy, to be able to point those out and name the tiers as part of the reason or part of the structure, always referencing back the purpose and the role of the tiers, I think is helpful. So, and it happens both at the tier 2 level and the tier 3 level, but sometimes it's drawing on an example that may seem separate from, but if it's related to children and families, looking at opportunities, for example, as things change in the state, like raise the age, well, that's a change in the state policy, but how does it affect us here at tier 2? So always kind of referencing back to those different stages and how the tier 3 is looking to the tier 2, to the county level leadership, to advise how to make those changes and how it can look different in different communities, but also across the board be powerful enough to have tier 3 make shifts, make changes, and really respond back to what the communities are replying with and how the leadership works in both directions. And that can't be done without hearing from the families. So it really does reflect all the way from tier 1, tier 2 to tier 3, back and forth. I think that's the only way to really make real change and have it be sustainable.
Right. We did a document at the TA Network a while back on state-community partnerships, and we'll see if we can't get that out to all of you to take a look at, too, and see if it would support your work. Julie, in the Cherokee Nation, do you cross over states, and do you have relationships between the Cherokee Nation and the state in terms of getting access to Medicaid or other resources that might be provided by states and not directly through the Cherokee Nation?
Yes, we do have a lot of state partnerships that we developed through the systems of care. There is also, with our billing, of course, the state is a pass-through for billing. So we have a liaison that we work with, if we have questions around billing and things like that. Our compact that we have, all the tribes in the state of Oklahoma have to agree to one contract with the state, and so it is extremely difficult to change that at times, but we have a really great relationship with them, with our liaison. Also, our state partnerships with the Oklahoma Department of Mental Health and Services, they provide a lot of trainings for us for free. Like regarding, we partnered together to bring forth child parent psychotherapy. We did not have that in that area of northeast of Oklahoma, so we partnered with them to bring in, the child parent psychotherapy to this part of the state, which has been great. They also provide us with trainings. We work with them. I'm always working with training opportunities, providing training as well as receiving training from them. Very close relationships with that department. Also with their child welfare, Department of Health and Department of Human Services has been a big partner. We partner with them on bringing forth the screener for all of the children in child welfare custody now do the SWIC in all of their cases for 0 to 5 for the Department for DHS child welfare. So those are just some examples of the partnerships we've had with them.
Okay. Thank you very much, all of you.
Beth, I was just going to say one thing. This is Gwen Goodlet again. I was just going to point out, I think sometimes even if you lack the formal structures, like the tier structures, which I do think is so helpful, I do think what Julie says is so important. It really is about those relationships that you have. And it's about tending and spending that time with those people that need that information. And I think it's one of the things I've learned, that the best work we do is when there's a good working relationship and a good connection between whatever system level you're working on.
Thank you. That's a really good point.
Great input. Thank you. So I want to thank everybody for your participation. We had a lot of participants on with us today, and I have to say over the years, back when I was a project director as well, some of the best learning I did, in fact the best learning I did was from my peers. So thank you. You got all four of these communities have been a great example of that. So thank you so much. As I indicated in the chat box, we're going to be sending a recording of this webinar and the resources referenced out to everybody who registered. There will also be a link to the recording in a TA Telegram as well. And please think about what other topics Beth and I can include in upcoming System of Care Expansion Leadership Learning Community meetings. And have a great day and happy first day of summer to everybody. Enjoy.
Thank you, everybody.
Thank you.